Good morning. We will call the September 1st, 2020 City Council meeting to order. Sandy, I think you can show all council members present with the exception of Councilman Cisco. May come in a second. Today's invocation and pledge will be Councilman Pretty. You all please rise.
Pray with me. Father, we thank you for another day that you've given us. At times these days can seem uncertain, and we pray that you would help us to look to you, help us to remember that your love for us and that you never change. Father, we know that there's many hurting in our community during these times, whether it's through job loss or health or family issues. Help us to remember to think about them and do everything we can to help. Father, help us to govern well, give us wisdom on creating policies, to think about our fellow man, and give us a desire to create policies that help benefit all in our community. Father, there's many in leadership roles here today. We pray that you give them wisdom in the hard decisions that they have to make daily, decisions that are tough and sometimes may not seem like there's a correct answer that will appeal to everyone. So, Father, we thank you for that. Help us to remember one another, and when we disagree, to have grace with one another and to learn from all in our community. We pray for your continued blessing on the city of Jackson. Amen.
Amen.
Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, Sandy, you can show all council members are present. Item 4 is approval of the minutes from the August 4, 2020 meeting. Council was emailed a copy of those. There are no additions or corrections to the minutes. They'll stand approved as read. Item 5 is proclamations and recognitions. Before I get to our lineup here, I want to call on Councilman Pickens for a special recognition.
Thank you, Mr. Mayor. First of all, I just want to publicly thank the folks out at West Bemis Missionary Baptist Church. This past Saturday, Councilman Dodd and myself were part of their big celebration. That church has been there for about 100 years. So they were celebrating 100 years of operation as a church, and you figure any church that can last 100 years, that's pretty awesome. So we got a warm reception from those folks out there, and Johnny and I even got to participate in the parade, so that was a big day. And then they had their big service on the Sunday following. But I just want to publicly thank the folks from West Bemis Missionary Baptist Church for having us to come out, and I wish them another 100 years for sure.
All right, thank you, Councilman Pickens.
Thank you, Mayor.
And before we get to the lineup, we'll let the council note that the bottom three, the school system, city court, and sheriff's department, were unable to attend due to previous meeting schedules, and so we'll get them at another date. And so for our recognition, we've got some reports on impact of COVID-19 across our city and across our county. So we'll start off just in the order that's on the list with our Director of Jackson-Madison County Regional Health Department, Ms. Kim Tedford. There, you can sit down if you want to, yeah.
Mr. Mayor, before we begin the presentations, I would just like to thank all of the agencies that are present. I called for this. It's important not only that the council know the direction that we're going, but also our citizens as well as our city and city employees. So first of all, we appreciate you being here, and we look forward to a vigorous discussion on COVID-19 and where we are as a city and how we can move effectively forward. So again, thank you for being here.
Well, first of all, I just want to say that I appreciate each and every one of you and your support during this time. This has been a very trying time for public health, and I just want to thank you for your support and the support from Mayor Conger. We meet daily at the beginning. Now we meet 3 times a week, and we take this job very seriously, and all decisions that are made by a group. They're made unanimously, and we couldn't do it without the support of all the leaders that meet with us every morning. So I just want to start off by saying that. This morning, as far as COVID-19 in our community, we have 2,321 cumulative cases in Madison County, That's up from about 28 from what we reported yesterday, so a little bit of a drop. We're averaging about 33 cases a day, which puts us in the critical red zone. Our positivity rate has certainly jumped up. It's around 16.4% of all the tests that are being done. Our testing is down a little bit across Madison County. I do think that's because most of the providers have stopped testing unless you're symptomatic, especially places like the Jackson Clinic at Convenient Care North. They have really scaled back on their asymptomatic testing just because of the load and the volume that it puts on the lab to read those tests. So our testing is a little bit down, but our positivity rate is up. Right now, we've got about 23 Madison County residents that are hospitalized, and we have 4 of those on the ventilator. We reported 3 new deaths yesterday. I will say that one of those families, that was the 3rd death that they have experienced from COVID-19 since the pandemic started. So it's very sad when we have to report those. We try to follow, West Tennessee Healthcare has given us our epidemiologist access to their records, so we try to follow our hospitalized patients on a daily basis just to see how they're doing and how they're progressing, and look at some of the treatments that are being used on those patients. Currently, we have about 341 active cases with 53 unknown, and if you follow our updates, when we say unknown, those are people that we either cannot get in touch with or they refuse to give us information as far as our contact tracing. So that's very frustrating for us because we do want to reach out to those that are have been exposed to COVID-19 to let them know they've been exposed and to give them guidance on what they need to do as far as quarantining to help flatten the curve. Our total number of deaths for Madison County is up to 46 deaths for just Madison County. That's not including all the deaths that the hospital have dealt with from surrounding counties. I want to tell you a little bit about our clinic services and how that's been impacted for Madison County since the pandemic began. Most of you know we do have clinic services. We offer vaccinations to children. We offer adult vaccinations and travel. We do family planning. We do an STD clinic and a TB clinic. And we've continued to do those services, unlike some of the other rural health departments. They've cut out services completely to focus on the pandemic. While we have decreased those, we've been able to continue those in a limited amount. We sure have tried to push some staff into the vaccination clinic because we don't want to deal with another outbreak of an infectious disease during a global pandemic. Our WIC services are located on East College, and they follow some federal guidelines, so they've been doing some curbside services and some services by phone that the federal government gives them guidelines to do. So those services have still been available to the community, and that's a much-needed service, so we're happy to be able to extend those services to the community. Another area is our environmental health services. That staff is a small staff, but they're responsible for doing all the hotel, restaurant, and pool inspections. They also cover the solid waste and the 10 solid waste convenience centers around the county, and they handle groundwater. And they've been able to continue to do those services. One thing that they're really helping us with is when we get complaints on restaurants or businesses that are not following the mask mandate. Candy Overstreet is my environmental health director, and she's able to use her staff to respond to those complaints and go out to restaurants, give them guidance. If they had a salad bar or a buffet open, and according to the guidelines from the governor, you know, that's a no-no right now. So they're trying to encourage those businesses on how to offer services and not be affected and still get to remain open. So they play an important role. I've got staff pulled. We do have a hotline that runs from 8 to 4:30, and there's a way for people after 4:30 to leave a message. So I've pulled 5 staff that answer those calls daily, and we have numerous calls that come into the facility on a daily basis. Our rabies control has not been impacted. We've left those rabies control officers intact, and they cover issues, dog bites, and dogs running loose in the county, so they've been able to continue that. The majority of our staff has been pulled to respond to COVID-19, our infectious disease department, our school-based dental program, because schools aren't in session right now, so they've been able to help out just with contact tracing, receiving reports from providers on positive cases. And we've been able to hire through some COVID-19 funds that we received from the state and the federal government. We've been able to hire about 20 people to help with contact tracing. We've trained those ourselves. We monitor those. We've got our conference room set up for little stations where they can make the calls to people that have been exposed and to cases to follow them throughout their illness. That's worked really well. A lot of rural health departments have turned over some of their contact tracing to the state, and we feel like we had more control if we did that locally. We tried to reach out to retired public health nurses to fill those spots, and to college-age kids that were home for the summer or between classes, between semesters, and our epidemiologist has trained them, and they're doing an excellent job in helping with that. Most of our administrative staff have taken over a lot of the duties of my department directors because they're part of our command staff. We do have our Health Operations Center open, and we man it during the day, and those calls roll over to my command staff at night, so we're answering the phone 24 hours a day. I'll be glad to answer any questions. Just wanted to give you a snapshot of the services that we offer and that what we've been able to continue to do through COVID-19, but it really is taking all of us in public health to respond to this pandemic.
Before we open up for questions, I just want to say, as being on that part of that group and that task force since the middle of March and having to deal with something that none of us planned for, there's no playbook for, that Kim Tedford has been invaluable to fighting and slowing the spread, flattening the curve of this pandemic, and giving us information. And we're very fortunate to have Kim Tedford here and her staff, and so I want to thank you for your leadership and all you've done during this time and all you do outside of the normal stuff, and then also the pandemic as well.
Thank you.
Any questions for the health department?
Kim, you said you had so far 46 deaths, is that correct?
Mm-hmm.
What is your time frame from where you began to count up until current? How many months has he been totaling that up?
We opened our Health Operations Center on March the 20th.
Okay.
The pandemic started a little bit before that. We were doing some work, but I would have to look back at the date that we reported our first death. Do you remember, Mayor Condor?
Early April, I think.
Probably so. The majority of them have occurred within the last month and a half.
And many of those, I assume, had underlying conditions as well?
Many did, some did not, but many did,
Okay.
as we would expect.
Right. Okay, thank you.
Mhm.
Any other questions?
Go ahead, John.
I don't have a question.
Oh, okay. I just have a few questions, Kim. We're really not flattening the curve, are we?
No, sir, we're not.
Okay, and this is not a hoax. It's not magically disappearing. The warm weather didn't send it away. Can you talk a bit about the positivity rate and how important that is to what you do?
Yes, the positivity rate is one percentage that we look at. And while it's difficult to look at the positivity rate, and let me explain why that's so hard to look at. Because we at the local level, we do not get the number of tests that are, in other words, the labs that report testing and providers, they report that through a system that the state uses, and not just our state, but it's nationwide. It's called the MBS system through CDC. And all labs are required to report positive and negative reports. We do not see the negative numbers. The only thing that are reported to us locally by providers are positive tests, because we have 24 hours to respond to those positive tests and make contact with that person that's positive. So I have to rely on some state data that figures up that positivity rate. And if you'll notice, a lot of times the numbers are lagging at the state level. When you compare the number of positive tests for Madison, or positive cases for Madison County compared to what we report, there is a lag there, and that has to do with two things. One, the tests that are put in by the lab is at their time that they put those in. The providers are reporting to us immediately, so our numbers are more real-time than what the state is. And with a lot of those, we made a priority to, our primary concern is getting in touch with that case, getting in touch with them, finding out their contacts, and contact tracing that case. Then my epidemiologists take the time to put those cases into MBS to send to the state. To us, that's more important than data being given to the state. So you'll see a lot of metros lagging in the number across the state because of that, because that's their primary focus, is to get in touch with the case rather than report data to the state. So that's never gonna be caught up per se. Probably will, but it'll be months, even years after the pandemic's over before our data really matches.
Kim, you said our positivity rate was 16%. Explain what a positivity rate is, and then give us an idea of, is 16% high? Is it, average? Is it low?
It's very high. Anything considered above 10%, even the 10% range is very high when you're looking at data. And the positivity rate looks at the number of tests that's being done and the number of positive tests out of that number.
Okay.
That's your positivity rate. So while our testing numbers may be going down a little bit, the positivity rate is not going down. It's remaining steady, if not increasing. And this 16.4% positivity rate, I just pulled off of data that had been updated yesterday.
I guess, where do we go from here? And what are some of your thoughts and suggestions?
That's a great question. Where do we go from here? We made the decision to do a countywide mask mandate, which was very unpopular with a lot of people.
And still is.
And still is, yes. We extended that for 2 weeks. And while I think the large portion of Madison County are doing what they're supposed to be doing, there's still a large portion of the county. There are people that don't do what they're supposed to do. And there's no way to slow the spread, flatten the curve, whatever you want to call it, until we're all doing everything that we can as to following the guidelines to help reduce that spike in cases. Now, we're never going to have 0 cases. That's not our goal. Our goal is to make it manageable for the community, especially for our healthcare resources in West Tennessee healthcare. And I don't want to take anything away from what JR is going to report, but they're in surge capacity, and that is our goal, is to reduce the strain on the healthcare facility, to reduce the number of deaths and the number of severe illnesses that we see in the community. And if there's one thing that I might add, just because you're young and healthy doesn't mean that you're not going to have a very severe illness if you contract COVID-19. You're not going to know how it affects you until you get it. And so that's the message that we've been trying to put out. Would not only protect the people that you love, but you need to protect yourself, because until you get it, you don't know what kind of effect it's going to have on your body. And there's still a lot of data that's going to be studied after this is over. But from several physicians, they're concerned about what the long-term effects this virus could have on your body.
Right. And you touched on it a bit. Children can get it.
Absolutely.
Right. Kim, do you think we came back too quick?
I'm going to speak strictly from a public health standpoint, so my answer
That's
would
why
be
you're here.
yes, that's why I'm here. I know that it's very hard to balance economics
Sure.
and health, because economics plays a vital role in the health of individuals. But specifically from a public health standpoint, yes, I do. I don't feel like that, let me just say this, when you get the report from the White House Task Force, which we just received, night before last, I think, was that they release those every 2 weeks. When you look at the state as a whole, we are still in the red zone. We are still not doing the things that the recommendations are to flatten the curve. That is a statewide mask mandate, which numerous counties do not have a mask mandate. Those recommendations are still having restaurants at 50% capacity, and some of those guidelines that we did do early on. But it's just a very difficult position to be in when you make these decisions.
Sure.
There's no easy answer.
Right. And we're not doing the restaurants. The restaurants are back to full capacity, correct? Okay, thank you so much, Kim, for being here. Appreciate it.
All right, any other questions? Yeah, go ahead.
I mean, I just want to thank Kim, and I think we all should stand and give Kim a hand because she's got a lot of weight on her.
Yeah, thank you.
All right, next up, we've got West Tennessee Healthcare. Before JR gets to speak, I just want to remind everyone, you know, the narrative, I think, seems to get spun that we're trying to keep people from getting sick. That's a byproduct of everything we've done has been about hospital capacity and making sure that we have enough resources to take care of the people that do get sick enough to go to the hospital. So, you know, anything I said that we're trying to prevent people from getting sick it's just not rational. And so it's about protecting our hospital system, and then I'll let JR talk about where our hospital system's at today.
Thank you, Mr. Mayor, Council. I appreciate this opportunity to just share RAP. I don't know if we can switch to this slide.
He's fixing it back there.
Okay. What I'd like to share is West Tennessee Healthcare is a system of 6 acute care hospitals and totals up to probably right around 1,200 beds. When everyone talks about saving the hospital system from being overrun, one way that I personally, this is James Ross, personally talk about that, we can talk about the actual capacity of hospital. But the hospital, as she mentioned, Kim mentioned, we're in surge capacity already. We plan for disaster situations where we will have a huge influx of patients. That's okay, I don't need the slide, that's fine. Tell them that's fine. We plan for situations where we can have this huge influx of patients. But the problem with this disease, with this virus, that's all right, just that's all right, good. The problem with this disease is it's ongoing, and the ability of it to, if you will, cross-contaminate our healthcare workers. So it's not really the capacity of physical beds. As I told someone, we have the capability at Jackson General to lay down in beds about 900 people. Now, that's taking up every bed, every location, that's outpatient beds, recovery room, all of those things. But the problem really, and that we have been so concerned about, is our workforce. Whether it's nurses, respiratory therapists, environmental service, food, all of the workforce that are there each and every day taking care of patients. They come in contact with COVID patients. They come in contact with limited visitors now, and then they're going back home. And then depending upon their loved ones and the others that they come in contact with, i.e. even church, then they can become COVID positive, and that takes them out of our capability to continue to take care of patients. last Friday, we had 22 nurses at 22 nurses that were out because they had been exposed. And when you look at an organization that already deals with trying to keep enough nurses, trying to keep enough respiratory therapists, that is problematic, particularly during this surge time. So we have adapted. We have taken our recovery room, taken 12 beds of the recovery room and made that into an intensive care unit. Why did we do that? Because we needed to take other ICU beds, traditional ICU beds, and convert those into COVID beds. Today we have an actual census of 536 patients. Of that 536 patients, 113 are COVID positive. When we traditionally have 77 traditionally what we would have in intensive care beds, we have expanded those beds and by moving patients into other locations. And so whenever you do those things, obviously you're taking patients out of the usual environment, you're taking employees out of their usual environment, and you're putting them in a separate environment to take care of these patients. So the whole disruption of the traditional provision of healthcare has to be taken in consideration. We have today, as I said, 113 COVID positive patients. We hit our highest number at 116. And when you talk about not flattening the curve, 116 was a new high for our number of COVID positives in Jackson General. So we have other hospitals and other locations. We have kept patients in those locations. We have beefed up the physicians as well as some of the clinical staff in those other hospital locations to help them keep patients in the communities where those patients may live. But we've also did some early back transfers back into those rural community hospitals instead of just traditionally letting you get as well as you can and discharging you out of Jackson General. We're sending you back to those rural communities. We've also implemented something that we call remote patient monitoring. A lot of you have heard about telemedicine, telehealth. We have really taken that to the next level, and I was told that we were the first in the state to be able to put this in place. In other words, you may need some supplemental oxygen. You're acute critical phase, but yet you're not well and you still need oxygen. Well, you can receive that oxygen at home. So what we do is we send you home with this monitoring packet where we can do blood pressure, we can monitor your oxygen saturation, we can monitor your temp, your blood glucose, all of those things remotely, and have a nurse or a nurse practitioner, advanced practice provider reviewing that data and looking at that data in real-time fashion. We have also had the opportunity to bring in ancillary staff. So it is not we like taking care of our own, but when you get in this surge capacity, you have to call on extra help. So we have what we call agency nurses or agency contract staff that has been brought into our healthcare system. As I checked yesterday afternoon, we have about 33 agency nurses here working with us now. Someone asked, where do we go in the future? I would just say that my incident command person is our Chief Operating Officer, Tina Prescott. She has said we need to be looking at the ability to care for 200 COVID patients as we move into this fall when the flu season and other respiratory viral things happen. So our Board of Trustees approved for us to purchase right at, $5 million. They gave us the approval to go at $5 million. And the majority of that $5 million would be spent on beds, on monitors. We're trying to buy pumps, but because the pumps that we use, the IV infusion pumps that we use, some of their components are made in China and they're held up in China. But anyway, we're buying the extra equipment for us to be able to utilize the North Hospital in a much more vigorous way. And then you have to speak about our physician providers. That has been a great concern for us. We've had three medical professionals that have led us through this COVID timeframe. Dr. Bob Gilroy, pulmonologist with the Jackson Clinic, well-known, very astute gentleman. Also, Dr. Priscilla Shawson, infectious disease provider, independent, and then Dr. Jackie Taylor, our lead physician executive for our system. They have, if you will, mounted this effort of our medical staff, coordinated this effort of our medical staff. But at the end of the day, you have to remember that our goal, our mission, our passion is to take care of one patient at a time. We're not like manufacturing where we're running widgets and we check ever so often the sample to see if the product is good. We're striving hard. We drop the ball. Absolutely, we do drop the ball, I confess. But it is our passion to take care of one patient at a time. And so doing that, whenever you see one death, or it gets real personal with me when our employees are in the hospital. We have one employee right now that is holding on, that's on a ventilator. And doctors have said does not look good. So it really, one death, whether it's 40 deaths, whatever the number of deaths, one death is what we're trying to prevent. So if I'm inconvenienced by wearing a mask, I confess, even as much as I have worn a mask, sometimes I forget. I left home the other day, now I put one in each pocket just to make sure. But even if that wearing of the mask prevents one death, we have a 2-month-old that is positive in the hospital. We've had teenagers that are positive in the hospital. And as Kim has said, this virus has no template to it about sickness. It doesn't say James Ross, 59 years of age, who's overweight, who has hypertension, will do bad. But it is an extra concern that James Ross is 59, African American. It is an extra concern. But James Ross may get this and turn around and go home. We've had folks in chief leadership roles, chief financial officer, right now my chief information officer, are out with this. And fortunately, they were able to stay at home. Each day we have a safety huddle at 9 o'clock. At 10 o'clock we have a system all call. And every couple of weeks we do a West Tennessee wide, every county except for Shelby County. We talk to every hospital and we share whether or not they have PPE. We share what the visitation rules are. We share if they need masks or any of those things. That's the type of camaraderie that has grown from this pandemic. Our concern, obviously, is if 200 the ability to take care of 200 total COVID cases is not enough. No, we have not flattened the curve. And as flu season, maybe masks will help. Definitely hand sanitation, definitely not shaking hands, definitely social distancing will help with flu, but at the end of the day, people are going to get flu. You notice our colleges, we've had reports of college kids being positive. So as all of that culminates, we have Labor Day coming up, and the concern about the number of people that will cohort together during that time is concerning for us. So I say all that to say that, yes, sir, it is real. And we have not seen anything like it before in my lifetime. And we're working very diligently. Employees are working very, very diligently each and every day to take care of those that come to us seeking help. I'll be glad to answer any questions that you might have.
Any questions?
Thank you, Mr. Ross, for your time today and updating us on the hospital, the challenges that the hospital has. You reported today 113 total cases. Rough math, that's about 20% of those are from Madison County. Could you speak to how important regional consistency is to the long-term health of our healthcare system?
Well, obviously, one of the slides that I was going to show, but that's fine, is that when the economic shutdown happened and the drop that we saw in the spread of the disease, yes, economics suffered, but also the disease suffered because it wasn't penetrating and spreading. So I really thank people like Mayor Conger, Mayor Harris, and Kim Tedford for implementing and doing what the science says needs to be done. We have worked with other counties, and thankfully those communities, some of those communities put in mask mandates. Dyer County, where we have another hospital facility, was one of the first to come on board after Madison County and others. But this disease continues to penetrate heavily in communities like Hardeman, Haywood, Henderson County, even Crockett County. So Haywood and Hardeman, I know, do not have a mask mandate. And as that penetration continues, they lead many times in some of the statistics of the state. So yes, having a uniform guidelines that are laid out for all of us definitely helps convert the spread or cut the spread that happens. And I really, we have met with the mayor and county mayor in Hardeman County and Haywood County. I'm sorry, in Haywood County a number of times, and have talked to the mayor in Hardeman County, and we've just not been able to move that. When you normally see places like Baptist Healthcare in Memphis, Methodist Healthcare in Memphis, St. Francis, Regional 1, when they all come together and they say you need a mask mandate, and that they talked to Fayette County, and Fayette County, I believe, implemented one. We're very, very appreciative of that.
Thank you. One more question briefly. The $5 million approval for additional equipment
Yes,
to take on these projected 100 additional patients, is that offset by any federal funding?
Yes, sir. Yes, sir. We have to attest on how we spend COVID dollars. And so as long as we can show that it was an expansion needed for COVID cases, and right now, as I said, a month ago, let's just say 6 weeks ago, we were seeing 30, 40 cases. Now we're seeing 100 plus cases. Obviously, that goes to our favor to get federal dollars to come down and help us buy that equipment. And we have to attest to that and show how that will be used. So we've received about 68 million in federal relief funds, but our losses are somewhere around 81 million, so there's a delta there, 12, 13 million dollars. But there's still funds that are hopefully coming to help us.
Thank you.
I have a couple questions, if I may. Could you make those slides available to us? Because I would like to,
Yes, sir.
like to see them. Hopefully, someone can help us with that.
Yes, sir.
And this could be a Kim question, but can anyone get a test who needs a test?
Oh, you're asking me?
Yeah, it might be a Kim question, but can anyone who needs a test get a test?
Yes, sir.
Okay, and how much is a test? How much does it cost?
There is no balanced billing to the individual at this time. The government still is helping defray the costs. We do bill your insurance company, and whatever they pay, then that's fine, but there's no balanced billing to you.
So,
There's no out-of-pocket expenses.
so if I don't have insurance, I can still get a test?
Yes, sir.
Okay. Explain a bit to me, at least, what you mean by the surge and how that, I know you've talked about what you've done because of that, but talk a bit about that.
Surge capacity for us is when we move outside of our normal operating environment to take care of this extra influx of patients that we're seeing. And so traditionally, we have 75, 77 intensive care beds. We have greatly
Expanded that.
expanded
I see.
that number. And we're looking to expand that number even more. And just to let you know some of our thought process, our surgery center, which is across the street from Jackson General, it has a connector to it. We're looking at converting that surgery center into an intensive care unit. It has 10 OR suites, which are fully equipped with anesthesia machines that can operate as ventilators. It's fully equipped with obviously oxygen and air and suction, those types of things. So that's an extra 10 beds. But also at our surgery center, we have another 20 or so rooms, spots that could be converted to ICU beds as well. And that's what we're looking at, being able to prepare that. And then we would move our surgery operation, outpatient surgery operation, out to the North Hospital.
And Councilman Taylor kind of asked the question that I asked. So you did get CARES Act funding during
Yes,
the
sir.
first round. Do you anticipate a second round, and how would you use those funds?
Yes, sir. We have received what I call the first and second round. Those funds have gone into stocking, believe it or not, the price of a gown has gone up considerably since this all started. Masks
Go figure.
prices have gone up. Our ability to get shoe covers for our OR, all of those things have gone up. So the CARES Act money is a cash inflow that we have been able to utilize to purchase those supplies.
And we hear so much about the ventilators, and seemingly, that's almost a dirty word when someone goes on the ventilator. Is that I don't want to say a death toll, but can you talk just a bit about, I guess, how important those ventilators are, and do we have enough?
Early on in the scenario, we ordered 20 additional ventilators above what we had in stock already. We have ordered an additional 20 more that have not come in yet, but as we look at this future capability, we need those ventilators. I'm not going to quote an exact percentage, but somewhere between 40 and 50% of the folks that go on ventilators do not survive.
40 to 50%. And seemingly, going forward, you're getting ready for this not to get better. You're getting ready for it to get worse.
Yes, sir, and we have requested 33 nurses, we've received 33 additional nursing staff, and we're looking, as I was told yesterday, to double that number to help us with the capacity issues.
And lastly, it's more statement than a question, but surely the closing of the smaller rural hospitals in our area has affected what you do and our capacity to do it.
One thing that I feel privileged that we were able to do, and that is to step in and work with Dyersburg and with Martin and this North Campus, because they have given us that extra capacity. We've been able to shore up and help assist Dyersburg and Martin in keeping more, let's say, sicker patients.
Mm-hmm.
And then also our rural communities where Bolivar, Camden, those locations, we have increased and have respiratory therapists 24/7. We're looking to put negative airflow, negative isolation rooms in those facilities so that they can continue to keep 1 or 2 or 3 of these COVID-type patients.
Thank you, sir, for being here. I know I appreciate it.
You mentioned the COVID dollars. One thing that you'll notice outside of our hospital are these big white boxes with the tubes running up to the 7th, the 6th, and 2nd floor. And our engineers came up with that idea to convert the entire floor. We have so many negative airflow rooms on each floor, but we were able to convert the entire floor to negative airflow by utilizing that piece of equipment. And so some of the relief funds are helping us pay for the rent on those machines.
Councilman Dodd?
Excuse me.
Thank you.
Mr. Ross.
Yes, sir.
First of all, thank you and your staff for the hard work y'all have done, because I know it's very hard work with the staff that deal directly with this COVID-19. But it's a rumor that I would like to clear up today, that they say that if a person died of COVID-19, the hospital get more money. And you get them calls every day, so could you kind of clear that up and explain how that works?
So most of you know that the hospital payment, healthcare payment system is on a fixed methodology. Only with some extraneous means of where you're in the hospital for 2 or 3 months or whatever, does Medicare or any other payer pay you more. So Medicare payment is called a DRG model. So whether you're there for 3 days or you're there for 30 days, Medicare pays you a set DRG payment. Medicare has come up with a COVID payment, and early on they came up with that payment methodology for patients who are Medicare age or Medicare recipients. What Medicare did, and what people are getting confused, Medicare said the amount of money that we're reimbursing hospitals for that COVID DRG is too low. So they increased it, I don't know, it went from like $12,000 to $14,000 per hospitalization. So it's a $14,000 payment irregardless how long you stay. Our average length of stay right now for COVID patients is right at 10 days. Our traditional average length of stay overall for our hospital system is 4.5 to 5 days. So if that gives you any kind of reconciliation.
Thank you.
Yes, sir.
Thank you.
Thank
Thank
you.
you.
And next up, we have Jackson Energy Authority. Mr. Jim Farrell.
Mayor, Councilman,
Good morning.
Good morning.
appreciate the time today to come and talk to you a little bit about what Jackson Energy Authority has been doing with this event. The Mayor mentioned earlier a playbook. I think in the utility business, we have a pretty good playbook for dealing with storms and natural disasters that come through our community. I don't know that anybody had a good playbook for this event. And so that's one of the first things that we did is we put together a team to try to look at how do we respond to this? Because our priority was to be, protect our customers, protect our employees, but continue to provide a good service to our employees, to our community. If you've been out and around Jackson any lately, construction activity's been very busy. I don't think it's been affected at all by this. I think our residential construction is the busiest I've seen in over 10 years. So one of the first things we did is we looked at our construction group. That's probably our largest group of employees, is how do we protect them? So the first thing we did is look at trying to put them into staggered shifts, put them in separate areas, not reporting to the same location. Because our concern was if we had this virus get into that group, we could stifle construction here in town. Also, for our in-house employees, we're just like any other business. We've tried to create as much social distancing for that group as we could. And so luckily, our IT group, over the last 10 years, has really moved us to a digital format. So a lot of our approval processes that we do are all digital now, so we're not moving papers from office to office. Also, we've moved over to laptops and tablets for our computer systems. So it's pretty easy for us when we wanted to maybe shut down some of our offices or have half the personnel in the office. We could do that by letting them go to the house and work from the house then. For our customers, we're like many of the other businesses. We shut down our customer centers for walk-in traffic for a period of about 2 months. And during that time, we remained open with our drive-through operation and our call centers. And the idea was, we still have to conduct business, so we tried to extend our hours. We had additional hours in there for the customers to go to the drive-through. We opened on Saturdays for a few Saturdays just to try to give them opportunities to do the business with us. During the time that we had our lobby shut down, we went in and we installed barriers between where our cashiers work and our customers are, and for our customer service reps. And so we got that done while they were shut down. But since that time, we have brought in architects to help us try to design a more permanent solution. So we'll be installing a glass barrier at each of our customer centers, and that should be done later this month, as soon as they get the equipment in for that. Another area we had was our field service technicians. So we tried to minimize the number of technicians that go into people's homes. That call volume has gone down because I think people just don't want technicians in their homes. But if you call in and you're looking for some type of service, we may ask you a lot more questions. So the customer service rep may ask a lot more questions. And in some situations, we've had the service tech call the customer and try to work through those problems without having to come in the house. Now, if you've ever dealt with an internet problem or a problem with one of your appliances, some things they're just going to have to come in the house to do that. And so the customer service reps are asking questions about the health of people in the house, so that if there is someone in the house that does have the virus, then that they can have the proper protective gear when they go in the house to do that. A few services that we've added since the beginning of this. We launched a new website last year, and one of the things that we added recently was a tab where you can request service through the website. So you can go on if you have a security light out or you want someone to check an appliance, you can do that through the website now. So you don't have to actually come in and ask anybody or call in. You can do it from a remote location. Another one we've recently put out was two-way texting. So there's a new generation of folks that would prefer to text than interact face-to-face. And so you can check your bill balance, check your due dates. You can send in information about outages through this two-way texting. And we've recently got that up and going. We have added 2 new kiosk payment locations. So currently we have a kiosk payment at each of our customer centers where you can go by and you can pay your bills and not have to interact with a person face-to-face. So we added 2 more in 2 of the local grocery stores here recently. So just some more options for customers to interact without having to physically be face-to-face with someone. Our whole goal here was just to try to provide the same service that we've always had. We may ask a lot more questions before someone comes to your home, but we want to continue to provide that same service that we've been doing before. That's all I have, if there's any questions from me.
Got any questions?
Okay, thanks. Hi, and thank you so much for being here and all you're doing. Is there a process for people that have lost their jobs or out of work that they can give you the documentation and setting up a certain payment plan?
Yeah, so the best thing for them to do is to contact one of the customer service reps, and they can talk through the process. There's some agencies out there, Southwest Human Resources Agency, they've got some means to be able to help customers that are going through this situation. One of the things that JEA did was we contributed to a kind of emergency response fund. I think the city did that, the county did, and we donated about $20,000 to that, and I think through a grant program, TBA matched that with another $20,000. So there's some funding available with that. And we've recently found out that TBA is going to open up for some more opportunities, so we'll be adding some additional funding to that too.
Good, thank you.
Jim, how will you get that message out to citizens? I don't think everyone knows that.
Yeah, I think the best way is probably through, some of our media channels. We've been trying to utilize our Channel 6 operation for public meetings such as this one, the healthcare updates every day, so we'll try to do it through that, because as I said, there's certain generations that like to communicate certain ways, and some folks don't enjoy technology. They would rather do it through the TV channel, so we'll try to put out some more advertisements through that.
We'd appreciate that, and I know that'd be helpful. And I guess my last question is, I'm sure you have a procedure in place for any employees that did contract the virus, correct?
We did. We've been working with the health department and, the guidelines through CDC to try to keep these folks quarantined. We've been very fortunate so far that we've not had a lot of spread through the organization. We've had some that have tested positive, but they've been able to be quarantined and not move that around to other employees in the organization.
All right, any other questions? All right, thank you so much.
Thank you.
Thank you.
Next up, we got Jackson Transit Authority. Mr. Franklin, good morning.
Good morning.
Morning.
First of all, let me say thank you for allowing me to be here with you today. Since March of this year, since the COVID-19 has been a great impact on Jackson Transit. Our fixed route services, which are the big buses, are down about 40%, along with our paratransit service, which are the smaller buses that are curb to curb, home to home. Fixture is down about 42%, and our revenue is down about 40%. In March, we faced what we named as the green fever. Out of 42 employees, we had 18 employees to call in sick all at the same time. Due to that, we continue to run the 11 routes that we have. We continue to provide the 4 paratransit services, causing the overtime rate to go up, causing us to double the amount that we were paying out in overtime. However, I'm glad to announce that we have not had any layoffs, we have not had any terminations or anything of that nature. At the same time, we've had 3 employees who have tested positive. We've had 1 employee who was out due to child care, and we have 1 employee who's out now due to household contact. Through FTA, through the Federal Transit Association and TDOT, Jackson Transit was awarded through the CARE Act $3.6 million. With that $3.6 million, it was divided into three payments. The first one was $900,000. The second one was $1.1 million, and then the third would be $1.5 million, depending upon our need at that particular time. Since we have faced this COVID-19, we have made, through the CARE Act, all of the necessary PPEs that the operators and their employees need. We have also provided each bus with hand sanitizer, gloves, where the buses are disinfected daily and professionally disinfected on the weekend. We have installed driver barriers on the buses. We're in the process of completing that project now, where the driver actually does not even come in contact with the public, as well as face coverings must be worn at all times whenever there is a passenger on the bus. I looked at our next step. Our next step is in adding digital monitors to our main office as well as to our transfer center, which we have gone to limited seating, which is 50% capacity now. We did go down to 10 riders per vehicle, and because of that, we had to put additional vehicles on the street at each day, because we had the motto that we would not leave anyone standing. So we look at, we have a monthly meeting with the entire staff. At the same time, we want to look at it day by day to see what happened on yesterday, as well as if we find out or we hear about anyone that has tested positive, we go back and try to find out if that person was a rider of any of our vehicles. And if so, then that operator would be pulled from service. We will contact the health department to find out what our next step should and will be. Thank you.
Quick question. As far as the drivers, what are you doing to protect them? Do you have any shields or anything?
Yes, sir. There is a shield barrier that the driver is behind. So when the passenger is boarding the bus, the driver is actually inside of a driver's pit with the shield beside them.
Okay.
Yes, sir.
Any other questions?
I have one. Good morning, Mr. Franklin.
Yes, sir.
Is ridership down?
Yes, sir.
Okay.
Ridership is down, and we look at ridership as whenever someone is going somewhere, either they're going to make money or they're going to spend money.
That's true.
And because of the COVID,
Okay.
right now,
Just not,
it's not doing it.
and that makes sense. Ridership is down and you're not carrying as many people, right?
Correct. That's correct.
Okay, all right. Thank you. Those are my questions.
The $3.6 million you spoke about from CARES Act funding, what is that going towards?
PPE, it also added the driver's barrier that Councilman Dawg was talking about. Any act that we see that could go towards COVID is paying for that.
Okay. How much do you have remaining at present?
We have spent the 900,000 out of the first round. We've just applied for the second round, the 1.1 million, as well as we looked at a bonus for the operators who have the dedicated drivers that has been there. Through the COVID Act, you are allowed to, we have to pay 80 hours, up to 80 hours. And the plan that we're looking at now is that by the end of the year, anyone who has not used their 80 hours, we're looking to give them a bonus.
All right, any other questions?
Would all this be reflected in your quarterly report that you'd send to the council?
Yes, sir, it is recorded, yes.
Okay. Can we make sure that we're getting those reports?
Sure. That's it, to
Okay.
Mayor.
I appreciate it.
Thank you.
All right, thank you.
Thank you.
All right, last one of the reports is Jackson Housing Authority.
Sandy, can you make a note to make sure that we get those reports?
Good morning.
Morning.
Jackson Housing Authority, like everybody else, we did not have a playbook for COVID-19, but we did have and disturbed a lot of people. That really did help us. Thanks to the city council's with mayor, and I must say, Kim Tedford. Housing is our thing, and that's our playbooks are. It's about housing and people. COVID-19 brought something different to the table, which we were not prepared for. And I look back at Kim because on the front end, we started calling Kim. We didn't have answers, and she was very, very instrumental in helping us to keep a base and giving us instructions on what we need to do straight off the bat. And the first thing we did was educate our residents. Some of our residents do not have cable. Some do not have internet. So we had to do this by bulletins and passing things out hand by hand to every last one of our units. About 1,033 units, all of them receiving paper information on the front end, and we kept updating that every week. At the same time, we started doing surveys to see what it was that our tenants needed to make sure that they were safe. And so we turned from housing just to make sure that our tenants were safe. And then as we moved on, we began to look at the school system, because at that time, they were thinking about starting school back up, and we found out more than we thought we knew. And we'll go into that in a minute about the internet system. But to date, we've had about 4 cases that resulted in death from COVID-19, and we had 14 that test positive. And as far as employees, we've had 3 that tested positive. We, on the front end, in conjunction with Kim, we were trying to work out a way, because transportation is a problem for some of our low-income families. We were trying to work out a way to get them tested. We ran into a problem because with HUD and our funding coming from HUD, we are very restricted on what we can do with those funds. So we're trying to work with other organizations to see how we can either get them to the testing sites, and if there was a fee, to get it covered. And by that time in May, when we started getting everything lined up, HUD did come through with waivers, and they gave us a bypass on a lot of things. Plus, they did send us about $400,000 for public housing to assist the residents and bring our operations up to par to operate telework. And so that's what we've been concentrating on, is making sure that we have PPE for our residents as well as for the staff and our maintenance team. Speaking of our maintenance team, we pulled back operations because they go in and out of so many units. We don't want them to be a carrier spreading it. So we are still currently operating on a call-by-call basis, looking at each request for a work order. And on all emergencies, we are taking those calls. We also look into some simple things such as like toilet paper and stuff like that. We have some on hand for our residents, because if they can't get it, they'll flush anything, we'll be caught with water problems. So it really made us think outside the box, and HUD became well aware of our issues, and HUD did move pretty fast to relinquish a lot of the restrictions that they placed on housing authorities. I'd like to also say that it's been very challenging, but with the partnerships here in Jackson, I think we're doing pretty good. And the main thing is trying to prevent the spread and educate our residents. And we did come up with a plan to quarantine some residents, and especially at we have one property that is a high-rise consisting of 124 units, 8 floors, and that presented a problem. It's an elderly high-rise with senior citizens and some disabled people in that building, and it did present a problem. With the help of the health department, Ms. Tepper, we were able to draw up a plan to get them off site. Now, getting the people to cooperate to get off site has been a challenge. And so we've been working with the Jackson Police Department as well as our staff to get everybody to communicate with that. I'm gonna go through these slides real quickly, and then if y'all have any questions. Again, educating them and working very closely with the health department was our main thing on the front end. And then we went into providing meals and other supplies so that they can quarantine in their units at all the other sites where they'd have to walk through a lobby, such as at the high-rise. Providing PPE. Also, like at Macmillan, we had to come up with a plan to restrict visitation, which is still going on at this time. And we work with a security guard company. When we're not at work, they're there from 4 p.m. until 8 a.m. to restrict all visitation in the building. And they use the iPods to get in. All tenants have to have a little iPod key to get into a key fob rather, to get into the building. Partner with Southwest HRA to provide meals for 9 weeks so that the people did not have to go out much down there. And we chose that plan for Macmillan because they are the ones that are elderly, didn't want to go out, and also a lot of them down here have some pre-existing health issues. Also, we partnered with the Jackson-Madison County School System and Rifle to get meals to our children during the summer months. Also in Macmillan, another thing that we work with them on, we work with Pathways for the Mental Health because that was a problem for a lot of them down there. So we've been working with the outside agencies as well to make sure they're all right mentally. Okay. We also partnered with JTA to, once we decided we could test and we were permitted to spend HUD funds on testing and on transportation. And JTA agreed to, and along with Christ Community Health, agreed to do the testing. They were gonna do it on site, and we appealed to every last one of our residents to go get tested. Less than 10% would agree to go get tested. And so therefore, we end up having to work with JTA, and JTA transported them to Christ, Community Christ Health Center to be tested. Our communications changed. We mostly doing everything by telephone these days rather than the tenants coming into the office. We also put drop boxes at all of the sites. We also instituted the online payment rentals, applications online, drop boxes for the income changes, and through HUD, we were also permitted to retroact if their income dropped in March and they weren't able to get in until May. We can go back and take that rent off them and base it off their income as long as they brought in proof that it actually took place at this particular time. And so that was a good thing for our residents. We also been keeping up our website and Facebook with our residents that do have it. Again, every time something goes on the website or Facebook, it is also handed out to every last one of our tenants on paper. Loss of income has been very detrimental to our clients. Most of our clients in low-income affordable housing, they are in the retail industry, in the home health care industry, and we saw a large drop in April and May in their income. And HUD did permit us to do repayment agreements with some of these families instead of evicting. You know, they had the eviction moratorium that ended July 25th, and there is a lot of people in our housing. I'd say about 30% of the people that can be evicted, and we are trying to work out agreements with them, which HUD allows us to, if they would agree to pay the money over a certain amount of time, not paying more than 40% of their income and rents, then we could allow them to stay. HUD, they must sign the repayment agreement because all the monies outstanding on the books at the end of the year affects our operations, affects our funding. And so far, we've had success with those repayment agreements. Our thing is not to evict. Our thing is not to evict, and we work with a lot of organizations and churches here in Jackson that have come to bat, especially for the residents that are really, really trying. But eviction will be last resort. We also, as you know, work with the Jackson-Madison County School System, and we was going to buy, HUD permitted us to buy tablets for all of our residents' public housing. And then it was better, after we did the survey and worked with the school system, it was better for us to get the hot spots. And so after, I guess about a year ago, if I'd have been listening to Brother Brooks, I probably would have had the hot spots. But HUD would not permit us at that time to buy hot spots or anything for the household. You can only do them for the community center if you had those grants. And thankfully, we did not have those grants, but thankfully, Madison County Library now has a grant, and we do have Wi-Fi in most of our community centers, and the Boys and Girls Club is there also. Also, we spent a lot of our CARES money on working with the Boys and Girls Club to get some of their sites set up because they serve a high percentage of our residents. And so that was very important because we can't have children who's quarantined in the house all the time. We need to have something for them to do that is productive. And so we got the hot spots in on Friday. Hopefully we'll be having those hot spots go out late this week or early next week. There's some things we have to put into place and policies and paperwork that they need to sign, because HUD wants us to make sure that everybody knows they're HUD's property and not ours. Any questions?
I do, please. I'm very excited about the hotspots. That was one of the first things that I wanted to ask.
Yes, ma'am.
Also about the eviction rate, is that something that you can kind of keep us abreast upon if there's not the funds, other local organizations? Because I think this is very important that we make sure that the people that have lost their income and the elderly, that we don't lose sight of that.
Yes, ma'am. I can give you that report. We look at it on a weekly basis and we report to our board on a monthly basis, the number of evictions and the ones that have a large amount, we go into detail about them, what's going on. But we can, yeah, most definitely share that information with you. And again, I will say, if they get evicted, it's because they wouldn't comply.
Okay.
Because some of them have some large amounts, and we're gonna take the hit. And as long as they're willing to pay. And we can go up to 40%. The law don't allow you to go 40% of their income, but we're not trying to get up to the 40% because we realize some of the other things they have to do, such as starting back to school. If they just don't agree to do something, then we will have to. If they won't sign the paper so we can show due diligence. It is our last resort to evict. Now that, if you see evictions, but other than non-rent, you may see that, okay?
Okay, good. Thank you so much. I just want to make sure we're in a good place.
Yes, ma'am. We are,
Keep those that
we've been
we-
working with the United Way and, again, some of the local
Right.
churches, and they've been coming up to pay, because we can't use HUD monies to pay the rent. And they know a lot of the housing authorities have a lot of outstanding rents on the books, and that's been the conversation for almost every week with HUD, and they trying to figure out how to do it, how to make it right.
Good.
with the
And thank
housing
you for
authority.
what you're doing. Thank you.
Yes, ma'am, thank you.
Just very quickly, Mark, could you make your slides available to us? I would like to see those if we could.
Yes, sir.
And want to thank you especially for, as you said, we've been working on the hotspots and the Wi-Fi for some time.
Yes, sir.
But thank you for your collaboration with those other agencies, not only Madison County Health, but
Right.
surely the Madison County School System.
Yes, most of the Jackson High School System, the city of Jackson here, the police department, special thanks, because it's been a job trying to keep our residents from congregating, which works to their benefit, as well as all our benefits. And that's been a challenge, but they've
Okay.
been very supportive.
And very quickly, can you just explain how the hotspot works for the children who are at home
Yeah.
now?
The hotspots, there'll be one hotspot per household with school-aged children.
Okay,
And what it is, HUD gave us a way to get the hotspots. But the monies we have, we cannot go past December 31st. But through the CDBG with the COVID funds and United Way, we were able to cover up through May.
all right,
And so the CDBG, along with United Way, is gonna cover January through May to get them through the whole school year.
right.
And the hotspots, they can charge them at their homes, and if they have to go somewhere else, they can still take the hotspot with them.
Wow.
And it is through T-Mobile, and it's in the city limits, very strong signal, so
right.
should not be a problem.
And that was a picture of it that, on the slide, that was the actual
Byron
device?
made slides, I'm on that,
Okay. You did a good job.
yeah.
But thank you, Mark.
Any typos or anything on that, y'all, please. Yes,
There was some other, I think maybe some previous discussion about some of the community centers, like at Lincoln Courts, you showed our group a number of weeks ago, using those as well for some virtual learning.
yes, yes. We, at Lincoln Court, we open up a lab, and they have to schedule, so we can do the distancing, social distancing. And we also have the open area there, if they want to come down and just use the Wi-Fi with their own personal devices. And we in talks with the school system about doing some more in the community centers. And they're going for a grant, look like it's pretty strong, they're gonna come through. And so they'll be doing some things at Lincoln Court in that community center well as in Washington Douglas. And we didn't go into Allerton Heights because the Boys and Girls Club has a very strong presence there. And like 15 internet devices there, and they're doing a great job, so we didn't want to bother them.
Okay.
Yeah.
Thank you again for all you're doing.
Yes, sir. Thank you all.
Thank you.
Appreciate it.
Thank you. All right, that takes care of our updates for the day, and so we'll try to reschedule those other three when their schedule
Mayor.
permits.
Before we go any further, we'd like to thank you for your leadership.
Yes.
I know it's been a hard time for you. You took this position not knowing, I was elected in this position, not knowing what you was gonna be facing. So we'd like to thank you and all the organization that is working together. When we go through tough times, this shows you how strong our city is. We all come together and work together. That's the great part of this city. So we want to thank you for your leadership. and what
We
you've
couldn't have
done.
done without the
Absolutely.
employees and the department heads, and those are the ones that deserve all the credit. They're the ones that have taken the lead on their individual departments, on how they can make the adjustments. So they're the ones that deserve all the credit in this on how we operate our city.
All right, thank you.
All right, item 6 is invitation for public comment. Any item on first reading be recognized if you have to speak in favor of or opposition to. Item 7, first reading, budget amendment for Jackson Police Department capital.
Good morning.
Good morning.
This first budget amendment is to equip 5 Jackson Police Department vehicles with, lights, siren, radio, and cages. These are vehicles that we currently have but need this equipment, and the funding for this will come from available fund balance.
Move the approval.
Second.
All right, before we get to the motion, the second, this is an item on first reading, open the public hearing.
Who's the second?
Councilman
Gary,
Harvey.
okay.
Anyone wish to speak in favor of or opposition to? Hearing none, I'll close the public hearing. We have a motion and a second. Any further discussion? Council, please vote.
Motion passed unanimous.
Item 2 is a budget amendment for City Hall repairs.
Thank you. Had some roof damage here at City Hall. Insurance recovery totals $52,700. So this amendment would recognize this insurance recovery and approve the repair of the roof damage here at City Hall.
All right, any questions on that? Item on first reading, I'll open the public hearing. Anyone wishing to speak in favor of or opposition to? Hearing none, we'll close the public hearing. Do I have a motion?
So
So
moved.
moved.
A motion-
Second, then Wallace.
Motion by Pickens, second by Wallace. Any further discussion? Council, please vote.
Motion passed unanimous.
Item 3 is a budget amendment for the AARP grant for JTA.
Yes, sir. AARP's granted the Jackson Transit Authority a grant totaling $35,500, which I understand will be used for the development of an app that will allow riders of the Transit Authority to track the location of their buses.
So moved.
Second.
Motion by Buchanan, second by Cisco. Open the public hearing. Anyone wishing to speak in favor of or opposition to? Hearing none, the public hearing is closed. Any further discussion? Council, please vote.
Motion passed unanimous.
All right, you're on the second readings. Item 1 is consideration of an ordinance to close and abandon a portion of an alley between Walnut Park, Roland, and Prospect Streets.
So moved.
Motion by Brooks,
Second.
second by McKelvey. Any further discussion? Council, please vote.
Mr. Brooks? Gary? Gary Pickens? Okay, it's there now. Motion passed unanimous.
Item 2 is a budget amendment for the Victims of Crime Grant. Is there a motion?
So moved.
Motion by Dodd,
Second, Wallace.
second by Wallace. Any further discussion? Council, please vote.
Motion passed unanimous.
All right, item 3 is a budget amendment for the TVA JEA Invest Prep Grant.
So moved.
Motion by Dodd,
Second.
second by Taylor. Any further discussion? Council, please vote.
Motion passed unanimous.
Item 4, budget amendment for Tennessee Arts Access Grant.
So moved.
Got a motion by Cisco,
Second, please.
second by Wallace. Any further discussion? Council, please vote.
Motion passed unanimous.
Item 5 is a budget amendment for the Tennessee Arts Placemaking Grant.
So moved,
Motion-
Wallace.
Motion by Wallace,
Second.
second by Cisco. Any discussion? Council, please vote.
Motion passed unanimous.
Item 6 is the budget amendment for JPD Capital.
So moved.
Motion by Cisco,
Second.
second by McKelvey. Any further discussion? Council, please vote.
Motion passed unanimous.
Item 7 is consideration of an ordinance to amend the animal control ordinance for the city of Jackson.
So moved.
We have a motion by Taylor,
Second.
second by Dodd. Any further discussion? Council, please vote.
Motion passed unanimous.
All right, get to new business. Item 1 is a consideration of a contract with Jackson Madison County General Hospital District for occupational health services. Thought Randy got a new job.
We all help out.
Okay, we received bids on the occupational health services bid. We received one, and it was from Jackson Madison County General Health District for $101,348. The price will increase 3% each year unless I rebid this. We did receive a bid from the Jackson Madison County Health Department. Their bid came in late, however, and they only bid on the flu vaccine and the Health B vaccine. Stacy is here, and she will explain this to you if you have any questions.
So we sent out requests for proposals for occupational health services, as Susan said, and we've received one from the lift, or Jackson Madison County General Hospital District. But that's where we're currently having these exams and testing done now. So it will just continue there. It is different because of a contract change that's coming up October 1st. We had to bid these out separately. These are services that are required by the employer to do for firefighters, police officers in certain types of jobs, and pre-employment physicals and those kinds of things.
Move the approval to Jackson Madison County General Hospital District. So moved.
Motion by Buchanan, second by Cisco.
Mr. Chairman?
Yes,
Can I ask a question first?
absolutely.
We talked about this a little bit in Thursday's meeting, but just for the record, I'd like for you all to discuss and let us know the cost savings benefit. Talk to us a little bit about that and how this is gonna help.
Okay, so we decided not to renew the clinic contract, and that will take effect October 1st. That portion of the contract will basically be where the employees go down for primary care or sick care visits where they don't have to pay for the office visit. So they can still go down there if they choose to do so. It will just be filed on the health plan. Our employees do have a small deductible, so they will potentially have cost out of their pocket if they have not met their deductible. If they have, 20%. We have added a program called Physician Now, or we will add it October 1st with Blue Cross Blue Shield of Tennessee to try to offset the loss of the free office visit at the clinic. So for a $20 copay, employees will be able to log on where they can do a telehealth appointment through Skype or a call. They'll have 24-hour, 7 days a week access to a board-certified physician that can handle some of those office visits with just that $20 copay. So we do expect to see, this first year might be a little bit less because of the overlap of about 3 months, but I'm hoping this year anywhere from $60,000 to $75,000, but potentially for next FY, maybe $150,000 is what we're hoping for.
Great, thank you.
All right, any further discussion? Council, please vote.
Motion passed unanimous.
Item 2 is a consideration of a contract with DC Construction and Trucking Incorporated for the SR 223 Site Development Project.
Bids were received on this project. We had 5 bidders. The lowest and best bid is from DC Construction and Trucking for $179,000. Wendy is here to explain this. I think Wendy's here.
Move the approval.
Motion by,
Sorry.
motion by Buchanan, second by Dodd. Any questions, further discussion? Council, please vote.
Motion passed unanimous.
Item 3 is a consideration of a contract with Translope for an automated vehicle location provider.
We received 3 bids on this project. First group, Paseo and Translock, and we have decided to go with Translock. They're not the low bidder, but they're the best bidder. And Lauren is here to explain this process for you.
All right, good morning, Mayor and Council. So this contract is for the grant that we had discussed earlier that we got through AARP to provide technology for a bus tracking service for the riders. So now you can know when to anticipate your bus as you're waiting for it. So like Susan said, Translope was the best provider. We felt like within the budget, they were not the lowest bid, but they were still within the budget with almost a 5-star rating versus a 1-star rating on another system. So we are moving forward on this so rapidly because our MOU for the grant, we have to be in a contract by beginning of October. So as soon as we have the second budget amendment, we'll go into that contract. This just gives us time to work out the details, and we hope to have the service in by December.
Mr. Chairman,
Yes.
they're not the low bidder, but the best bidder because of the 5-star rating.
Because of the rating and because of their ability to add on what we have now, be able to do mobile pay in the future and some other things for our riders, which the other provider did not offer.
Okay, good.
This will also provide Wi-Fi on the buses too, this system.
All right, any additional questions? Is there a motion?
Move to approve.
Second.
Got a motion by Taylor Pretty, and then
Taylor Pretty.
a second by Wallace. Any further discussion? Council, please vote.
Motion passed unanimous.
All right, thank you. Item 4 is a consideration of a contract with Town and Country Realtors for real estate services.
Hey, good morning, everybody. 5 Walnut Grove Co., that's what we own, that's what we're gonna sell. Hopefully, if you approve this contract, Ms. Holt will be our agent listing that. We're here to answer any questions for you.
Can you give a quick background on how we came about this property?
We acquired it at a time, I believe, and correct me if I'm wrong, Stan, that we were looking at widening that road, and we've held on to it. You know, we had a long time, and that's not currently in our long-term plans to widen that road, so we'd like to dispose of the asset.
All right, is there a motion?
So moved.
Motion by Dodd,
Second.
second by McKelvey. Any further discussion or questions? Council, please vote.
Harvey. Motion passed unanimous.
All right, thank you. Item 5 is consideration of a contract for a lease agreement with Northwest Tennessee Head Start for 409 Island Street.
It's a renewal of the lease they have now, 10 years.
So moved.
Second.
Moved by Buchanan, second by Brooks. Any further discussion, questions? Council, please vote.
Motion.
Mr. Chairman, I want it duly noted, that's where I started school.
We won't,
I'm glad we already voted, because somebody might have changed their votes, and they said you started school there.
Washington.
Motion passed
And your
unanimous.
fire chief.
Item 6 is consideration of a contract with Express Employment Professionals.
Express Employment Professionals, the locally owned, they're one of the 2 that have approached us to do some headhunting services to help us fill some high-level positions. City engineer, perhaps internal auditor. This is the first of one that we hope you approve. There's no payment up front. There's only a payment to them. It's 20% of the salary. if we choose their candidate.
So moved. And motion by Pretty.
Second.
There's a second by Dodd. Any further questions or discussions? Council, please vote.
Motion passed unanimous.
Item 7 is consideration of the contract with Align.
Same thing here for Allergen, 20%. We only pay if we select the candidate.
So moved.
Motion by Dodd,
Second.
second by McKelvey. Any questions? Council, please vote.
Motion passed unanimous.
Thank you.
Item 8 is a consideration of exchange of services from the Milan Fire Department.
Morning, Mayor and council members.
Morning,
Jay.
Morning.
City of Jackson Fire Department wishes to enter into an agreement with the Milan Fire Department. We want to transfer ownership of a 1998 Expedition SUV in exchange for the use of Milan's accelerant detection canine. This will give us an opportunity to increase our presence and cut down on the investigative time for arson fires. And the canine will also be available for our public education events as well. And they will let us use their dog at no expense to the city of Jackson.
So moved.
Motion by Cisco, second by Pickens. Any questions or discussion?
Mr. Chairman,
Yes.
would you just mention about the 5 years and how much that we're gonna be saving doing the, not having the car on the road and that the dog for 5 years?
Yes, this is a 1998 Ford Expedition. We will not have any maintenance costs. Milan will take ownership of the vehicle. It is a surplus vehicle, so it would be off of our records.
Thank you so much.
Any additional questions? Council, please vote.
Motion passed unanimous.
Thank you.
Thank you, Chief. Item 9 is a consideration of a resolution to approve the Consolidated Annual Performance and Evaluation Report, FY19, FY20, Jackson Housing Authority.
So moved.
Motion by Buchanan,
Second.
second by Dodd. Any questions or discussion? Don't sit down yet, just in case you have questions. Council, please vote.
Motion passed unanimous.
Item 10 is an update from the Anti-Poverty Task Force, the annual report.
As you all know, we launched the Anti-Poverty Task Force a year ago in August, and so I've asked our chairman, Mr. Matthew Marshall, to provide a report to you all today. We want to try to do this every year. He's going to share some really valuable data, as well as some updates on projects that we've been working on and how we anticipate moving forward, and how we'd like to work with you moving forward.
Good morning, City Council.
Good morning.
The mission of the Anti-Poverty Task Force is to develop strategies for reducing poverty, inequality, recidivism, and addressing other quality of life concerns among all low-income and vulnerable populations here in Jackson, Tennessee. The task force is to work in partnership with the Mayor's Office and City Council to implement policies and programs that will further this mission. Over 2019, 2020, this past year, we began to work, as Lauren mentioned last fall, analyzing available data concerning vulnerable populations in our city. The primary sources for that data was the Annie E. Casey Foundation's Kids Count Data Center, the Jackson Housing Authority's assessment of fair housing, and United Way's Alice report. We then took that, took what we learned from that information and developed subcommittees aimed at addressing the most glaring problems. But I want to start first by going through some of the key findings that we discovered from the research. The first will be in reference to the Kids Count data. Annie Casey Foundation is a national organization, but its data that it releases every year is a trusted resource for the Tennessee Commission on Children and Youth. And you'll see that our county overall rank for 2019-2020 was 92nd out of 95 counties in Tennessee. And what this data is particularly pertaining to is the educational, economic, physical, and social well-being of children in our community. So again, we rank 92nd out of 95 counties. Our fair market rent, we rank 66. As it relates to child poverty, we rank 49. Our school suspension rate, we rank dead last. Our teen pregnancy, we rank 60th. 3rd through 8th grade reading proficiency and math proficiency, we rank 91 out of 95 counties. Our high school graduation rate, we rank 92nd. In our chronic school absenteeism, we ranked 89th. Now, you could ask, what do all these things have to do with poverty? Well, of our population of students, we ranked 82nd for them being economically disadvantaged. So there is a correlation here between the struggles that our students in our city and our school system are facing and the backgrounds from which they come from. And as many of us already know, I'm sure I'm preaching to the choir, education is the way out of poverty. But this data is revealing for us that our families and students have a hard time making that progression. If we go on to the Jackson Housing Authority's analysis of impediments, these are just a few of them, not all of them. Some of the key issues are housing affordability and insufficient incomes that many families have. And so that is households having inadequate income to acquire housing currently available in the market. We also see issues with the low number of loan applications, primarily for minorities, and low origination rates for minorities. If you skip down to about 2/3 into that paragraph, we'll see that for the most part, our white citizens here in our city, they have loan originations they take up about 76.4% of the total loan originations in our community. African American applicants only account for about 14% of those originations. And then our Hispanic Latinx citizens account for about 3.8%. And the reason why I think that point is important to make is because of the next impediment that the Jackson Housing Authority's analysis found, which is the prevalence of predatory lending practices in our community. And so as you can see there, it has absorbed the market that was formerly controlled by FDIC-insured banks and other reputable financial institutions. And unfortunately, it's becoming, according to this analysis, the choice for some low-income and minority-concentrated areas. Just a simple Google search that I did found over 22 predatory lenders in our community. I'm categorizing that by payday loan, car title loan types of institutions. To put that in perspective, the normal or the average interest rate charged on one of those payday loans or title loan at one of those institutions is 300%. And it has been estimated that it drains our state economy of over $403 million a year. And we have at least 22 of those in our community. The reason why I bring this up, and there is a recommendation later on for this to be something that I think the City Council can address, is because there are communities and states that don't even allow payday loan and title loan types of businesses. So I won't belabor that point. Other issues that the Housing Authority's assessment found is high poverty and low income among minority populations. And so, according to the 2005-2009 ACS census averages, it shows the incidence of poverty among African Americans was 37.2%, and among Hispanics, 19.6% of their total population, as compared to our white citizens, where the data reported that it's only 10.2% for those who live in poverty between 2005 and 2009. We'll see that again more clearly in just a moment when we look at United Way's ALICE data. Also, there's the reasons for the high poverty and lower incomes is primarily due to limited job training, workforce development, and economic opportunity among minority populations, and a lack of access to healthy, affordable food choices. So for many households, low access to healthy, affordable food translates into higher incidence of nutrition-related diseases, including diabetes and heart disease. Lastly, from this section, limited affordable housing units, and resources to assist lower-income elderly and disabled homeowners to maintain their homes and stability in their neighborhoods. Moving on to the ALICE reports, you'll also see here that according to the data, the median household income in Madison County is $45,013. That is approximately 13% lower than the state average. And what that actually equates out to mean here in the city limits is that 48% of households in Jackson are either ALICE, and by that we mean working poor, or they are actually living in poverty. And this is based on 2017 data. I just received the 2018 data in the last 6 days after I completed this report. Through that analysis of that information, they were missing several households from 2017, and when we account for those, that number has gone up to 58% instead of 48%. And when you break that down according at least to single headed households, if it's a single female headed household, 80% of them are either working poor or living in poverty, and 60% of single male headed households are either working poor or living in poverty. Again, as was mentioned by the Jackson Housing Authority's analysis, 58% of Latinx, 58% of Black, and 40% of Asian are ALICE, working poor or living in poverty, compared to 31% of our white citizens. So to put that another way, if you are Latinx or African American, you're almost twice as likely to either be working poor or living in poverty in the city of Jackson. The average household survival budget in Madison County is approximately $48,192. What that means is what it takes to survive. That's for a family of 4. That's just their survival budget. However, if you were to ask what it would take to actually operate a stable budget for a family of 4, this is assuming that those 2 children need childcare, that would be $93,180 is what it would need to be, twice what that median household income actually is. Committees that we created to address some of these needs were the Equality Affordable Housing Committee, Education and Skills Training Committee, Health and Wellbeing, Thriving Neighborhoods Committee, and then the Employment and Business Opportunities Committee. We have met, most of those have met several times, but as you can imagine with the pandemic, a lot of that has been slowed down. Prior to the pandemic, we had scheduled a handful of events, namely the Resilience Film event, which focused on adverse childhood experiences and beginning to educate the public about that issue. That was initially scheduled to be at the Dent McWhirter, and we had to cancel that event. We also had a fair housing event to tackle and begin to talk about some of the issues that I've already brought up here in this report. That too, unfortunately, had to be canceled. We do have a Handle with Care initiative that we are still pursuing. That is a project that was based out of West Virginia, and the short version of it is that if you have a child who's encountered at a scene, at a police scene, that police officer would take the name of that child in the school where they attend and would notify the school, child's school by the morning of the next day to let them know simply the child's name and the words "handle with care." And so the idea behind that is, imagine how many children go to school every day having encountered something traumatic. They act out in school and no one knows that it was because of that traumatic experience. And then we end up expelling them or whatnot. And so this is a way to hopefully fix that issue. We have gotten buy-in from the JPD as well as from the school system and several other partners, juvenile court and others. We are just now looking for funding, and so we're seeking out grants to be able to get that program started.
Question really quickly. What
Sure.
what does the amount of funding look like needed for that?
What we applied for on this last round was about $60,000.
Okay, thank you.
So on to the last part of the report. These are possible task force action steps and recommendations for the city of Jackson. Number one, we would encourage the improvement of JTA services, advocating for budget transparency and accountability there, research and propose improvements to the system that are rider-driven, which would include alternative payment options. So card payment, mobile payment, app, something of that sort. Right now, you can still only ride JTA services by paying cash, and you don't get change. And so that's an ongoing concern. but also technology for bus tracking and communications. Those were the things that were just presented earlier. And so we would advocate for those things. Also, opportunity zone strategy and vacant lot activation. So working with city and city developers to identify areas to pitch to investors for restorative development. Examples might be the Lane Avenue commercial corridor and other parts of East Jackson. Working with the planning department, mayor, and council to potentially even donate or lease vacant lots owned by the city for affordable and mixed income housing. And as a part of that initiative, potentially requiring 1% of affordable units, since that's one of the issues that was brought up through Jackson Housing Authority's analysis of impediments. Also providing small developer boot camps for new contractors and people who want to be engaged in that process. We also would advocate for making the city's bid process more accessible and inclusive. So working with the purchasing department to develop processes, form for the website and other developing contacts. Also assisting minority and women-owned businesses in getting their license and certifications to be eligible to bid. And then also propose minority women-owned business enterprise considerations and requirements for that process. We also would suggest making the city's events and venues more welcoming and inclusive to minority vendors. And we, again, could work together with city staff and the mayor's office to identify policy and marketing changes. We've also talked about a mobile resource hub, which would be a repurposed hub with 6 kiosks to help provide specific resources and also provide mobile Wi-Fi. Some suggestions for resources at the hub could be for census filing. All of us know how tough the census has been to actually get the community to participate in this go-round. But also report filings, legal resources, housing referrals. We've also talked about a mobile farmers market as an option as well. We have a meeting set up later this week to discuss that option. And so there's other opportunities for that. Another suggestion would be the establishment of a homeless shelter, something that a city our size desperately lacks. Somewhere that would provide a safe and consistent shelter for those in transition that partners with nonprofits to provide wraparound services. It is great. It's an awesome service that Area Relief Ministry provides with a room in the inn. But we are dependent as a community on that nonprofit to do that on their own. And again, most cities our size have homeless shelters. So some type of more permanent establishment would be a great need and great encouragement to our community. Also, the expanding of the educational opportunities, so providing a pathway to certifications and degrees for young adults in particular. Strengthening public schools through innovative after-school programs, restorative justice and ACE-informed care, early literacy and comprehensive pre-K. These are all conversations that we've had with Jackson-Madison County school system leaders and that they would be in support of. Lastly would be the establishment of a City of Jackson office of equity and inclusion, an office that could help oversee all of these recommendations that we put forward. So providing assessment of the City of Jackson's department policies, procedures, operations, et cetera, with a focus on equity and inclusion, a review of policies, practices, and laws related to arrest and jailing for nonviolent offenses, such as driving without a license and or proof of insurance. That last recommendation comes after conversation with several leaders in the legal system in our local community, like Judge Pride and others. It's been estimated that 70% of the individuals sitting over in our jail cells are there on revoked and suspended licenses. And so that's not the only thing that they were arrested for, but it was one of the things that contributed to it. And so ways that we could work together to combat that, and this Office of Equity and Inclusion could have that as a priority. I know that was a lot, sorry.
Yeah, Mr. Marshall, thank you very much for the work that your task force and Ms. Kirk, the work that y'all put together. I know this is not nearly as comprehensive, though it is a lot to digest. I know that this is just the tip of the iceberg of what we need to do in this community. But I appreciate, I know we all appreciate the work that y'all put in. Do you have a current city council member that is participating in this task force?
We don't, and that's something that we wanted to suggest, is having one or multiple city council members involved as we look at
I'd be
legislative.
happy to volunteer myself for that.
Yeah, I've asked to help too.
If we start, just really quickly, kind of running through the JTA services, just to get all this on record. JTA, it's my understanding they're supposed to provide us with quarterly reports on their financials. I've yet to see one of those. That's one of the things that we need to make sure as we go through these bylaws that all of these entities that are under the city of Jackson or in cooperation with the city of Jackson and Madison County are reporting on a timely basis to those entities, their financials. JEA is one of those that I've identified that hasn't done that. As we go through opportunity zones, you know, y'all have discussion about the CRA and their participation in those areas. As far as your second point there, the donation of land, I know that we've worked in some different capacities in the past on having a number of lots that are in District 2 that may be available for that. I think that's something that we continue to look at and get that message out there. A lot of people don't know the process that they need to go through. Back down to city's bid process, we've had some talks about getting those, compiling all the necessary vendors, making sure that we're reaching out into communities that may not get that information through traditional channels. I agree with that. The AMP, I think that's an opportunity for us to diversify the programming that we currently have. We've been riding on the same apps over there since its inception. It's time to switch that up, and I think that's an opportunity to have some different culture come into the AMP and be able to share in that as Jacksonians. Jackson Parks and Rec, we currently run an after-school program with high demand. I would like us to really look at what funding we could provide in future years to expand that program if necessary. I think it's something that is praised throughout the community. We have people literally camping out. I know we're changing the way that we do that, but that's something that I think we could focus on. Again,
there's a conversation right now that we're having with Jackson Police Department and others about a collaboration and partnership for a reestablishment, or this would be a reestablishment of the Jackson Boxing Club, but the establishment of a PAL, which is a Police Athletic League. This is a very common practice in most other communities, and it's a way to build partnership between the community and the police force, where you have a place where the police officers can volunteer and all of that. Tony's not in here anymore. I was looking back to see Tony, but he's part of that conversation as well, and we're having discussions about the establishment of something like that as also an alternative to traditional punitive types of means with the school system. And so if a kid gets in trouble, maybe they go and are a part of this PAL instead of just going to alternatives.
Mr. Chairman, Mr. Marshall, thank you for joining us today. Something that really piqued my interest was you mentioned the predatory lending. Have you examined any policy or legislation from other areas? I'd like you to share that with us, and I'd encourage council and whoever else wants to get involved. Let's take a look at that. You take the people who can't get a loan and charge them 300% to get a loan for money they don't have that they really need for something. Not that lending is an evil institution in general, but I would encourage us to take a little time to look at the current practices in place in our area and see if perhaps we could work together to find some more reasonable practices that wouldn't necessarily ban that style of lending altogether, but put some regulation, some cap on it, because I don't care who you are, 300% is a ridiculous rate. And as you said, it's taking advantage of people who are already in a vulnerable position. And one more thing, I'd spoken to the mayor about this when he worked with United Way, and you as well. I believe the blueprint is that Middle Tennessee has a successful blueprint for a financial literacy course. If there's any way possible, we need that in our community.
Sure. Yeah.
Councilman Pretty works in the lending arena, as did I for a period of time. The minorities that can't get loans, it's because of the credit score. They don't know how to budget. They don't know how to build a credit score, things of that nature. So anything that we can do to empower the members of our community that need help, we need to all get behind it, because it's a major issue. It absolutely is.
We've already begun having those conversations with some of the banks, and every bank opts or has an option and offers financial literacy courses. So that was one of the first conversations we had with one of those committees. The other issue, though, in some of the lending practices, even for your traditional FDIC insured institutions, is that statistically, people of color often, even when they are better qualified, still get often charged higher interest rates. And so there's another part of that, that even, we've had this conversation, even if we move into a place where we restrict payday loan institutions, we also have to fix the other side. And that's why we're having those banks come to the table as well to have those conversations. But yes, those are all big concerns. And financial literacy is a huge part of that as well.
It's not just the practice, it's the location as well.
Yes.
I mean, financial
Right.
districts.
May I say something?
Yes.
Chairman? Mr. Marshall and Ms. Kirk, I can't tell, I just want to be a little bit personal right now. This should be our number one thing that each of us should be working together to do. We have enough organizations to pull together. The loaning, as Councilman McKelvey was saying, I took a lady to try to pay hers off. They wouldn't let me write a check. They greeted her with open arms like she was their best friend. And this affects our arrest rates, our population in our jail, drug abuse. This is the key to everything right now in our city and how we are moving in the direction to pull our school system together, our area relief. So anything that we can do, we need to do this. And I would like to see, at least at our council meetings, that we have a report each month, but make us accountable too. We've got to get on board to help with this. So once you all really, however we can help, but make us accountable, that we have to do this. We have to pull these people together, because this is critical. This is, to me, one of the most critical things that each one of us should be very passionate about and be working for. So help us be accountable.
Thank you. And we can move to a shorter monthly update, just if that would
Right.
be more digestible as well.
All right, thank you all both so much.
All right, thank you.
Thank you, Matt.
All right, item 11 is ratification of the private act. This is the final one we have to do for the private act for the Great Wolf Lodge area. And so you should have a copy of that ratification. State legislature approved it, and so we have to ratify it now to finalize it.
So moved.
Second.
Motion by Buchanan, second by Brooks. Any further discussion? Council, please vote.
Motion passed unanimous.
Item 12 is consideration of a street acceptance request for Shiloh Springs, Section 5C, number 47 through 48, Shiloh Springs.
So moved.
Moved by Sisco,
Second.
second by Wallace. Any discussion?
Mr. Chairman, for the sake of time, can we consolidate the next three into one vote?
Yeah, so we'll have to create a motion, so it just.
We've already
creates
voted
another
on one.
So,
I would like to make a motion that we consolidate items
we
12.
already have a motion and a second on the
Yeah, they
floor.
already, most,
So,
second motion is
All right, you wasted time. We good on that.
council, please vote.
Motion passed unanimous.
Item 13, consideration of a street acceptance request for Shiloh Springs,
So
Section
moved.
13. So moved, second.
Second.
Second by first Brooks, Taylor.
Yep.
Council, please vote.
Motion passed unanimous.
Item 14. I'm gonna start reading, y'all, somebody motion.
So moved.
second.
Motion by Taylor, second by Brooks. Any discussion? Council, please vote.
Motion passed unanimous.
Item 15, consideration of invoices over 10,000.
So moved.
Motion by Dodd,
Second,
second by
in
Brooks.
honor of Councilman Pepper Bray.
That's right.
All in favor? Council, please vote.
Motion passed unanimous.
All right, no further business come before the council. Meeting is adjourned.